I think that's another important part of our education, that it may be that, patients being diagnosed with CLL, we may have said, yes, we don't need any upfront treatment, but we should make sure that people are well informed that actually, as a result of the CLL, their immune function isn't as good, that in some ways where other people out in public domain, yes, we would say, go on, you can manage those symptoms, but patients should have a much lower threshold. So often we'll say, well, phone us for advice or link in early with the GP, but equally we've got to make sure that we've educated the GPs to sort of say, actually, this is the patient group who do need assessment. Are they getting colds that, is it starting to settle on the chest? They haven't got a fever, but they're starting to cough up, discolored sputum. Those are the patients that need more prompt treatment with antibiotics. That's often quite an emotional question, obviously, coming from the patient. So what I tend to say to patients, obviously it depends a little bit where they are in their journey in terms of, are they on active treatment or not at the present? So of course we know that, patients with CLL have an increased background risk. So in that way, I would sort of tend to advise patients that, of course, they need that contact, and from an emotional well-being and psychological thing, they need that family contact. And in some ways, it's just saying, just have perhaps a bit more awareness of sort of what measures. So it might be that, bit of extra hand hygiene. If in some ways, the young child or whatever has had recent vaccinations and they're live vaccinations, so limiting contact maybe for 48 hours, after they've had their polio vaccine or whatever. If obviously, it may be that maybe at this point, if a patient particularly is on therapy, so obviously they've got an increased susceptibility to infection, I perhaps sort of say, well, maybe then, rather than grandma stepping in and changing nappies and doing all this sort of, have the sort of, pleasurable activities and sort of, other members of the family doing, more of the sort of, intimate sort of nappies changing care and whatever. And if obviously children have got very, very active infections, and obviously, if, they're going through their childhood illnesses, then in some ways there should be a bit more limited contact. So, but it's sensible precautions. I think it's not putting so much fear into the patient that they're sort of thinking, actually, I am isolating myself from family and friends, which is not helpful from a psychological perspective. So I think it's knowing that they can access advice. Yes, and I think, again, what we should be doing is, as well as us being the contacts, again, I think sometimes, we need to be more active in promoting other organisations as well that are out there. What other sources of support are out there? Because I think you're right. I think people can feel quite isolated, and sometimes the hospital isn't always the source for the rest of that external support. So sometimes being able to put patients in touch with organisations where they can buddy up with people who've gone through diagnosis, maybe going through similar treatments. So I think in some ways I think there is more that we can do to try and reduce that isolation. And that's why having these sort of forums, it's very good feedback for ourselves to sort of see the value of that and how valuable that is for patients to network.